My name is Emma Chikuka, and today I will be discussing ethical data governance and AI decision making lessons from the United Health Navi Health case. Artificial intelligence and big data are becoming increasingly important in healthcare. These technologies help organizations analyze large amounts of patient information, improve efficiency, reduce costs, and support better clinical decision making. However, they also raise important ethical concerns related to patient privacy, transparency, fairness, and accountability. The purpose of this presentation is to examine a recent ethical case involving AI, explaining how strong data governance can help prevent similar issues and recommend strategies healthcare organizations can implement to ensure AI is used responsibly. The case I selected is the United Health Group Navi Health case. In 2023, United Health was sued over allegations that its AI powered predictive analytics platform influenced decisions about Medicare. Advantage patients receiving post acute care. According to the lawsuit, the AI systems recommended shorter lengths of care than physicians believed were medically necessary. Patients and families argued that these recommendations resulted in denials of needed services and that the technology was prioritized over physician judgment. This case received significant national attention because it highlighted concerns about algorithmic bias, transparency, accountability, and patient advocacy. It also raised an important question that many healthcare organizations are facing today. How can AI improve healthcare without replacing the expertise and judgment of healthcare professionals? One way organizations can address this change is through strong business intelligence and health data governance. Business intelligence uses data analytics, dashboards, and reporting tools to identify trends, monitor quality measures, evaluate organizational performance, and support evidence based decision making. Healthcare leaders can use these tools to improve patient outcomes, identify operational inefficiencies, and monitor the performance of AI systems. However, business intelligence is only as effective as the quality of the data being analyzed. Strong data governance ensures that healthcare data is accurate, complete, secure, and compliant with federal regulations such as HIPAA. Data governance also establishes accountability by defining who is responsible for managing data, protecting patient privacy, and monitoring the ethical use of AI technologies through the organization. Big data models also play an important role in improving both clinical and financial decision making. Predictive analytics can identify patients who are at higher risk for hospital readmissions, allowing providers to intervene earlier and improve care coordination. Organizations can also use big data to evaluate vendor performance, forecast staffing and resource needs, reduce unnecessary costs, and improve their operational efficiency. Although these technologies offer many benefits, healthcare leaders should remember that AI should function as a decision support tool, not replacement or clinical expertise. Healthcare professionals understand individual patient needs, medical history, and personal circumstances that an algorithm may not fully recognize. Human oversight remains essential to ensuring safe, ethical, and patient centered care. The United Health case also demonstrates several important ethical, legal, and regulatory considerations. Ethical organizations have a responsibility to ensure that AI systems are fair, transparent, and free from unnecessary bias. Patients should have confidence that healthcare decisions are based on both reliable data and professional clinical judgment. Legally, Organizations must comply with HIPAA, Centers for Medicine and Medicaid Services requirements, and applicable state privacy laws. They are also responsible for maintaining strong cybersecurity protections and ensuring vendors meet contractual and regulatory expectations. Failure to properly govern AI systems can expose organizations to legal liability, financial penalties, and damage to their reputation. Based on this case, I recommend three primary strategies. First, healthcare organizations should establish an AI governance committee that includes clinicians, health information management professionals, information technology specialists, compliance officers, and organizational leaders. This committee should oversee an AI implementation of approve policies, monitor performance, and ensure compliance with ethical and legal standards. Second, organizations should perform routine algorithm audits. Regular testing helps identify inaccurate predictions, unintended bias, and disparities among different patient populations. Continuous monitoring improves transparency and ensures AI systems continue performing as needed. Third, organizations should require mandatory clinician review before any AI recommendation is used to make final patient care or coverage decisions. AI should provide valuable information to support healthcare providers, but licensed professionals should always retain responsibility for final clinical decisions. Ongoing staff education is also important to so employees understand both the capabilities and limitations of AI technologies. These recommendations improve patient safety, reduce bias, strengthen regulatory compliance, and increase trust amongst the patients, providers, and the healthcare leaders. They also demonstrate that organizations can successfully adopt innovative technologies while maintaining ethical standards and protecting patient rights. In conclusion, artificial intelligence and big data will continue to transform healthcare in the years ahead. The United Health Navi Health case reminds us that technological innovation must always be balanced with transparency, accountability, and human judgment. By investing in strong data governance, responsible vendor management, and ongoing oversight, healthcare organizations can improve patient outcomes while maintaining public trust, delivering high quality, ethical care. Thank you for your time and attention. I appreciate the opportunity to share this presentation with you.